Welcome, my dear audience and friends, to the Cancer Convos. This is your host and content creator, Grace Charrier, coming to you from New York City, the city that never sleeps and is home to the Cancer Convos. During the launch episode, I had told you that I would be bringing in experts from various fields in the cancer world. On today's episode, I shall be featuring a guest, a very important professional, someone who is dedicated, who is kind and generous, somebody who has played a very important role during my cancer journey, from my diagnosis unto my remission. He's the president and the CEO of the Brooklyn Cancer Care, a reputable cancer care outfit based in Brooklyn, New York, and he has brought lots of happiness and smiles to the faces of cancer survivors and patients. He is no other, ladies and gentlemen, than Dr. Ratesh Khillan. You're welcome, Dr. Khillan.
Thank you so much.
Thank you for having the time to come be with us today.
Sure.
Out of your very, very crazy schedule.
No problem.
I know that there's a listener out there that's waiting to hear from you about your take on this crazy, crazy disease.
Sure.
Are you happy to see us?
Yes, I am.
Very, very nice. Dr. Khillan, please tell us about your background and where were you born and your education.
Sure. So I'm born in India and in a very poor family. I went to medical school in India. There's a town called Patiala where I went for my medical school. After medical school, I did for 2.5 years training in surgical oncology, and then I moved to US. And when I came here, so the first doctor who interviewed me for a job for internal medicine actually offered me this position for oncology right there. And then he said, "You have already experienced oncology. Why don't you, pursue your career in oncology?" So that's where it all started.
Wow.
And since then, I did my residency from State University of New York, Downstate Medical Center, Brooklyn, and I did my fellowship, same place, for 3 years. And I was on faculty there for 3 years, and which gave me a lot of knowledge, a lot of learning I did over there. And that's when I decided to stay in Brooklyn, as it feels like home to me. I never felt an outsider. So that's where it started. That's my education. And October 1st, 2012, I started this company, Brooklyn Cancer Care. And we started from 2 rooms, 2 small rooms, 10 by 10. And we were able to so far, create this nice cancer center in Brooklyn. And we are hoping to grow more, adding radiation and, other aspect of cancer care in Brooklyn.
So what actually made you specialize in oncology?
I think it was destiny. In medical school, I still remember when I was a 4th year medical student, and first time I went to see a patient. So I went in, and this old lady I saw, and when I was examining her, I was like, "Oh, this lady looks like has cancer, gallbladder cancer." I still remember. That was a long time ago. And turned out she did have gallbladder cancer.
Wow.
And from that point to going into that surgical oncology fellowship in India, and then coming back here and getting hem-onc, I think it was made for me. That's how I feel. One thing happened after the other one. So that's how I end up here.
Oh, wow. That's fantastic. So apart from patients and everything that you have seen during your journey as a medical doctor specializing in oncology, have you had anybody that has been close to you that has been diagnosed with cancer?
One of my aunts, she died from gallbladder cancer in India within 15 days from the diagnosis up to the end.
Oh my God.
And I myself has a little nerve sheath tumor. Although it's not aggressive or anything, I still go for my appointments. And the feeling I had day one when I didn't know what I had, so only thing my doctor told me, "You had a tumor on your spine," and I got scared. That was first time, I think, I could have relate with my patient's feeling, like how they feel. I was like, oh my God, what's gonna happen? What if it is something, dangerous? And
Malignant.
so I still remember from the time they told me I have this, and my appointment and an MRI was 1 week. The whole 1 week, I remember how I went through the emotion, and I was like, wow, that's how my patients feel. I think that gave me a lot of knowledge about how my patients are feeling about this. And, I'm still thankful to God. It's a benign thing. It's sitting there.
Amen.
And I go for my appointments every year. We do scans and everything.
Oh, wow.
Yeah.
So is that you, I'm taking you back to what you said about starting the Brooklyn Cancer Care. Was it as a result of your passion, or did you feel that, there's an underserved community that could benefit by you starting this legacy? Because really, this is a legacy. So what was your push to start this?
So, I when I finished my fellowship, I got a fantastic job in Ohio, Cleveland, Ohio, $500,000 salary.
Oh my goodness.
But I was something was missing there. I didn't feel a good fit in that environment. And I was here from last 6 years, and then 3 more years as an attending. I can relate more to this population than population in Ohio. So there was something missing, and I did not go for it. And I decided, you know what, I'm going to stay in Brooklyn. It's a battlefield here, let me tell you that. Right from patients, how we manage them, healthcare is a disaster in Brooklyn. And what I thought, I can fix it. That's what I thought. I'm trying my best. And that's the future for me, to fix healthcare in Brooklyn. It's a disaster all over. Different reasons. We can spend 1 more hour right on healthcare in Brooklyn, but I don't want to go in more details. But that was something in my mind, that these patients, they need little bit different track as compared to patients who are in Manhattan, who go to Memorial Sloan Kettering. Our patients here, they are not good fit for Memorial Sloan Kettering. Just for a small example, for my patients, to bring them in my office, we call them. They think it's my responsibility or it's our responsibility to do that. But if they go to city, they don't go to their appointment, no one call them. You're on your own. So I think that was the main reason.
That personal touch.
Yes, and I think that was also main reason for success for Brooklyn Cancer Care, that we provided a personalized care here.
True.
So I think that's what made me stay back. And this whole home environment, it feels like home, as I said. Where in the world you can go and get food from every country of the world, and even better than that country, right?
Brooklyn.
Brooklyn.
I know. That's so wonderful. That's so wonderful.
All right.
I said we're talking about the diverse food in Brooklyn. So, bringing you back, we hear so many stories about certain types of food being the cause of cancer. Please educate us.
Yes. So we don't have any study which shows that if you eat this food, you will get this cancer. If you eat that food, you will get that cancer. But there are some evidence, and it's proven, if you eat foods which are very rich processed food, like which have nitrites in them, like sausages, hot dogs, processed food, more processed food, they are definitely leads to cancer. Which one are those cancers? We don't know exactly right now. But we know if you eat more fresh fruits and vegetables, drink more water, and eat food which is not processed. Problem is with processing.
Not processed.
So not processed food. Lot of food we are putting so many insecticide, pesticides. We have proof that people who work with these insecticide and pesticide, like farmers upstate New York, they have more diseases like multiple myeloma, lymphomas. We know that. So these chemicals, they are not safe. So, but I don't think so we can pinpoint which food is good, which one is bad. In my personal opinion, it is my personal opinion,
Yes.
any food which can stay on your shelf for year, 2 year, 3 year, I don't trust that food. I was raised, in India, and over there, my mother never let us eat food which she cooks in the morning, even after a few hours. So, I believe food should be eaten very fresh. It has to be not full with some chemicals which make it shelf life through 2 year, 3 year, 4 years.
Right. So what about sugar
Yes, sugar is the enemy.
and certain types of honey? Because
Sugar is the enemy.
we get confused between honey, organic honey, and pure honey. Some people say pure honey is bad, but organic is good.
So, one thing we have to remember, everything in moderation is okay. Don't go nuts in anything. Vitamins, sugar, carbs. There's a lot of these things comes up. 5 years, carbohydrates are bad. Next 5 years, carbohydrates are good. Next 5 years, fats are good.
Exactly.
I think if we do everything in moderation, that's the key. Even sugar, we can have sugar, not in excess. The problem is the sugar content of the food, some of the foods, is so high that we don't realize when we eat how much carbohydrates or sugar is in that food. And one more thing, very, very interesting. People always relate bad food to sugar. They don't understand. If some food like rice, if it's not sweet, it doesn't mean it does not have sugar. It has a lot of carbohydrates. So we are now going with no sugar, no gluten, no this, no that. I understand that. But we are forgetting that those things which are no sugar still have carbohydrates.
Exactly.
So we have to balance. We have to have some carbohydrates, some protein, some fat. Some sugar is okay, but not too much. I still remember I had a patient, female patient. She was 100-year-old. I asked her, "Do you smoke?" She said, "Yes." "Do you drink?" She said, "Yes." I said, "So what is the secret sauce here?" She said, "I don't smoke too much. I don't drink too much. I smoke 1 cigarette a month. I drink 1 beer maybe in a week. I enjoy my life. I do everything in moderation." So I think everything in moderation is the key.
Yes, the key to even preventing anything
Absolutely.
to crop up.
Absolutely.
So, as regards chemotherapy, as you know, the audience and listeners they all know now that because of my issues with cancer that birthed the Cancer Convos, chemotherapy is tough on cancer patients.
It is. It's very
and,
tough. Yeah.
I've spoken to so many cancer patients and survivors like me who have said it wasn't just the thought of the diagnosis, it was actually facing the chemotherapy. Is there no other way or any other alternative method of trying to nip the cancer in the bud by trying to face it, by trying to cure it?
One message I want to give today is when we search for cancer care or cancer treatment, when we Google it, there is so much information. And I'm not saying that information is wrong. The problem is there are so many types of cancers, and every cancer is different than the other ones. So what happens, patients pick up stuff which they like from the internet and they interpret it as, oh, chemotherapy is bad, this cancer is, so, I'm going to die from it. So if you have breast cancer and you are looking internet, what happened to a patient with pancreatic cancer is totally different things. So information is important, but as long as you can get the correct information. Now, your question about chemotherapy. Chemotherapy is very tough, especially in breast cancer. Why chemotherapy is so tough in breast cancer? Because it works. And most of our patients are young like you, whose body can handle it. And what we want to do, we want to kill this cancer forever. So we don't want to compromise that cure part by giving you some substandard mild chemotherapy, which puts you on risk of this cancer coming back. But saying that, future is different. Future of cancer is immunotherapy. Future of cancer treatment is genetics. We are having now, especially in Brooklyn Cancer Care, we are focusing so much on personalized cancer care. So basically what we are doing now, every patient who comes here, we try to get as much as information on that particular cancer. What types of genes which are abnormal in this cancer? And can we have a cocktail of treatment which is designed for that particular gene, especially in lung cancer. We don't treat lung cancer now like we used to treat 2 years ago. We have so many newer immunotherapy treatments which we give to patients based on their genes. That's science.
Yes.
I think that's going to be future of cancer care. I think we're going to go far. I don't think so chemotherapy will exist in next 10 years.
Great.
It's going to be replaced by immunotherapy. But that caused one problem. It's 5,000 times more expensive than chemotherapy.
Exactly.
How are we going to sustain that? I don't know.
Yeah.
We have to bring those
Based
prices
on
down.
what's happening right
Absolutely,
now.
absolutely.
And now, what is the difference, for example, between the treatment of breast cancer and, say, prostate cancer? Because right now as we speak, my uncle is undergoing prostate cancer. And he gave me so many things. He's not even here. He's in Africa. And you can imagine that we're still coming up as regards cancer treatments and everything. How would you differentiate between the two as regards treatments?
Breast cancer is the most common cancer in women. Prostate cancer is the most common cancer in men. Combined together, lung cancer is the most common cancer of both men and women together. So, a lot of difference in treatment for breast cancer and prostate cancer. Breast cancer is much more aggressive as compared to prostate cancer. Prostate cancer is a disease of aging. As we age, everyone will get prostate cancer. If you do autopsy on 100-year-old males, almost 90% of them will have prostate cancer.
Really?
Yes. So it's basically a physiological disease, not a pathological disease. Breast cancer, on the other hand, is a pathological disease because of some genetic modification. That's why it's much more aggressive and it's happening more and more in younger people,
Yes.
younger women. By saying that, the area where I practice, prostate cancer is very aggressive and it is pathological in mostly African American men. It's a problem, very aggressive, and it starts very young. Treatment for prostate cancer starts with hormones.
Hormones.
Yeah. So that's why it's much more easier as compared to breast cancer. We do use hormones in breast cancer too, and more, we are having very good hormones coming up in the market, which are replacing chemotherapy actually. But prostate cancer, to start with, is hormones. And if we can find it early, we can just do radiation or chemotherapy and we can just nip it in the butt right there.
Right.
So comparison-wise, much easier treatment and much more success rate in prostate as compared to breast.